The second part of therapy is the treatment planning that you're going to see us do a little bit later. This is the hypothesis formulation in a research project. In therapy, it becomes making the treatment plan. And we're going to make that treatment plan collaboratively with our client. And this is where we're going to go from their goal formulation to my treatment plan, which we will see us do. And we're going to also, the way the treatment plan is going to look when we're done, it's going to have 3 columns. It's going to have our revised version of their goals. And that's because some people bring us in 40 goals that get collapsed to 5. Some people bring us 1 goal that has to be expanded to 6. It depends on what they come back with. It's also somewhat, usually a lot of information what they bring you back. You know, obviously the OCD patients bring you back the 40 goals, very specific, etc. Here in the treatment plan, we've got goals. The second column you're going to see is going to be measures of those goals. And the third column is basically the content areas. That's my hypothesis. My hypothesis is that if I do cognitive therapy, if that's one of the interventions listed for elevate mood, that I believe that's going to change the scores that I've recorded in the middle. And, by the way, I share that hypothesis with the patient, the client. So I say, I think this is going to work for that. Now we do the experiment. So this is really the bulk of the therapy. This is where you are teaching them assertiveness, or you're doing cognitive therapy, or you're asking them to confront an avoidance. These are all the experiments, and they're always designed in a way that we can measure their effectiveness. So we're going to send them out to do experiments. We're going to ask them to rate this on some scale before they do it. We're going to ask them to rate it while they're doing it. And we're going to ask them to rate something afterwards, because we're going to collect a lot of data. Another thing you might know is that behavioral therapists generally make the assumption that people are very bad observers of their own behavior. So we need to teach them to observe. We need to teach them better data collection strategies. When we finish the experiments, we look at the results, just like in a research study. That's just gathering the results. And we're going to highlight, we're going to summarize, and we're going to say, it seems this worked for that. It seems this did not work for that. And then what we're going to do is we're going to move and we're going to broaden the scope toward the end of treatment, because when a symptom has changed, it often has ramifications in a system. It often has positive ramifications. There's often generalization of the success. So we're going to then say, and how is this going to affect other things in your life? Let's talk about it now that you're no longer afraid to ride on elevators, if it was something that specific.